targeting zombie cells in blood vessels shows promise for diabetes treatment. New research suggests that eliminating senescent, or zombie, cells lining blood vessels could be a key strategy in treating metabolic diseases like diabetes. The study, published in Cell Metabolism on November 20th, identifies a direct link between the buildup of these cells and age-related metabolic dysfunction. The role of senescent endothelial cells, senescent cells, are those that have stopped dividing but remain in the body. While some senescent cells aid in wound healing, their accumulation over time is increasingly linked to age-related diseases. This study focused specifically on endothelial cells, which line blood vessels and are vital for metabolic regulation. Researchers found that when these cells become senescent, they release inflammatory molecules, disrupting metabolic processes and contributing to insulin resistance and obesity. Experimental evidence. Mice and human tissue. The team conducted experiments using mice. Obese mice with high levels of senescent endothelial cells were studied after those cells were removed. The result: lower fat mass, better blood sugar control, and improved metabolic function. Conversely, transplanting senescent endothelial cells into healthy mice induced insulin resistance and elevated blood sugar. To confirm the findings, the researchers then tested Phistin, a senolytic drug that eliminates senescent cells, on both mice and human tissue samples. In both cases, Phistin reduced senescent cells and improved glucose tolerance. Tests on obese adults showed similar results. Implications for aging and disease. The findings suggest that targeting senescent cells in blood vessels could address a broad spectrum of age-related diseases, not just diabetes. Dr. Cristina Aguayo-Mazzucato of Harvard Medical School notes that by focusing on a unifying target like blood vessels, treatments might be developed that combat multiple aging-related conditions simultaneously. Rather than treating cancer, diabetes, Alzheimer's, or Parkinson's as separate entities, the idea is that they are all age-related and share common pathways, says Aguayo-Mazzucato. This research represents a significant step towards developing therapies that tackle aging at a fundamental level by addressing the role of senescent cells in metabolic dysfunction.